Hi, my name is Patty Hoffer, and my presentation today will be on the evolution of guidelines regulating research in healthcare. So, the overview of this presentation, I hope to address what is ethics in research and why is it important? What are the guiding principles to ethical research, and how and why were the guidelines for regulating research in healthcare established? So the first question we need to answer is why. Ethical guidelines for human subject research arose out of abuse of power, unethical studies, and significant harm caused to individuals by participation, often involuntary and without consent in research. So what is ethics in research and why is it important? According to Resnick 2020, there are several reasons why it is important to adhere to ethical norms in research. First, norms promote the aims of research, such as knowledge, truth, and avoidance of any errors such as fabricating, falsifying, or misrepresenting research data. Second, since research often involves a great deal of cooperation and coordination among many people in different disciplines and institutions, ethical standards promote the values that are essential to collaborative work, such as trust, accountability, and mutual respect and fairness. Third, many of the ethical norms help to ensure that researchers can be held accountable to the public. Those researchers who are funded by public money can be held accountable to the public. Fourth, ethical norms in research can also help to build public support for research. People are more likely to fund a research project if they can trust the quality and integrity of research. Finally, many of the norms of research promote a variety of other moral and social values, such as social responsibility, human rights, compliance with the law, and public health and safety. What are the guiding principles to ethical research? First, every research study is designed to answer a specific question. The answer should be important enough to justify asking people to accept some risk or inconvenience. Two, a study should be designed in a way that will get an understandable answer to the important research question. This includes considering whether the question asked is answerable, whether the research methods are valid and feasible, and whether the study is designed with accepted principles, clear methods, and reliable practices. Third, the primary basis for recruiting participants should be the specific goals of the study, not vulnerability, privilege, or other unrelated factors. Fourth, uncertainty about the degree of risk and benefits associated with a clinical research study is inherent. Everything should be done to minimize the risk and maximize the potential benefits. Uh, Five, to minimize potential conflicts of interest and to make sure a study is ethically acceptable before it starts. Six, potential participants should make sure their own decision about whether they want to participate or continue participating in research. This is done through a process of informed consent, in which individuals are accurately informed of the purpose, methods, risks, benefits, and alternatives to the research. And finally, individuals should be treated with respect to any research project. Research meaning respect their privacy, respect their right to change their mind, informing them of new information that might emerge from the research, monitoring their welfare, informing them about what was learned from the research. So, what were the turn of events that have contributed to the evolution of the guidelines? As you can see here, this is a sequence of events that have become significant in the evolution of guidelines and regulating research in healthcare. I'm going to talk about the historical overview in more recent times without going back in history prior to the 1900s, because these events, before this time, there were no regulations regarding the ethical use of human participants in research. So first, we're going to start about the Nuremberg Code. This code in 1946, as the American Military Tribunal opened criminal proceedings against 23 leading German physicians and administrators for their willing participation in war crimes and crimes against humanity. Among the charges were German physicians conducting medical experiments on thousands of concentration camp prisoners without their consent. Many of these participants died and were permanently crippled as a result. And as a direct result of this trial, the Nuremberg Code was established in 1948, stating that the voluntary consent of the human participant is absolutely essential, making it clear that participants should give consent and that the benefits of the research must outweigh the risks. So, into the late 1950s, we have the thalidomide research project. This was a project that was done. It was a drug that was approved in Europe, but it was not approved by the FDA here in the U.S. This drug was designed for sleep and nausea during pregnancy for women. Unfortunately, what happened, it caused severe deformities in many babies. These women were unaware of the effects, and they were not consents were not given. U.S. Senate hearings followed in 1962 with the so-called Kefauver Amendments to the Food and Drug and Cosmetic Act, which were passed into law to ensure that drug efficacy and greater drug safety. For the first time, drug manufacturers were required to provide the FDA with the effectiveness of their products before marketing them. So the Declaration of Helsinki in 1964 was the World Medical Association where they established recommendations regarding medical doctors and biomedical research involving human participants. So some of the issues addressed in the Declaration of Helsinki is research with humans should be based on the results from laboratory and animal experimentation. Research protocols should be reviewed by independent committee prior to initiation. Informed consent from research participant is necessary. Research should be conducted by medically, scientifically qualified individuals, and risk should not exceed the benefits. So from 1932 to 1972, almost a 40-year span, was a research project that involved 600 low-income African Americans. 400 of them were infected with syphilis and were monitored over 40 years. They were given free medical examinations. However, the participants were not told about their disease. Even through a proven cure, penicillin, even when it became available, the study continued until 1972 with the participants being denied treatment. In some cases, when the participants were diagnosed as having syphilis by other physicians, the researchers intervened to prevent treatment. Many of these participants died of syphilis during the study, and the study was finally stopped in 1973 by the U.S. Department of Health, Education, and Welfare because of its existence was publicized, and it became a political embarrassment. And from that, due to the publicity of the Tuskegee syphilis study, the National Research Act of 1974 was passed. The National Research Act created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. It was charged to identify the basic ethical principles that should underlie the conduct of the biomedical and behavioral research involving human participants, and to develop guidelines which should be followed to ensure that such research is conducted in accordance with those principles. And from there, the commission drafted the Belmont Report. And the Belmont Report was a statement of ethical principles and guidelines that should assist in resolving the ethical problems that surround conduct of research with human participants. And from that, through the some of the important points from all these unfortunate research projects that went on, the Nazis' atrocities in World War II drew attention to the lack of international standards on research with human participants and led to the formulation of the Nuremberg Code. The thalidomide disaster led to the adoption of the Kefauver Amendments with the Food and Drug Administration. The Declaration of Helsinki is the basis of good clinical practices used today. The Tuskegee syphilis study is probably the worst case of the unethical human participants research and study in the U.S. It's very unfortunate. And finally, the National Research Act codified the requirement that human participants in the research must be protected and set the stage for the assurance of the Belmont Report. So the next study is our recent guidelines, and these are recent examples of the evolution of guidelines in healthcare that continue to evolve and adapt new ethical considerations and advancement in recent methodologies. So where do we go from here with the evolution of ethics in healthcare? It's an ongoing process that requires reflection and adaptation. It requires collaboration among healthcare providers, policymakers, researchers, and our communities. Most importantly, by sharing our knowledge and best practices, we can address ethical dilemmas and work towards a more ethical and compassionate healthcare system. Thank you very much. I hope I addressed all the overview questions. Thank you for your attention.